Hey guys, welcome back for another episode of 5 Minute EMS Review, where we give you short and to the point videos on different EMS topics. Except not today. That's right. Again, it's time for another 5 minute EMS tangent. I mean, really, you have a stubbed toe and you think that you should be able to go straight to a hospital room just because you rode the ambulance. Let's think about this for a minute. Okay, so listen, I get it. I understand. We as EMS professionals have a duty to serve those who call on us, regardless of the severity of the complaint. And we really do try to be professional and courteous, regardless of the complaint. Even if you stubbed your toe and there are 6 cars in the driveway and you live 1 mile from the hospital. But that's beside the point. Another story for another time. Today, I want to talk about this idea of getting straight to a room at the hospital just because you rode the ambulance. A lot of people think that's the case. Let's look at it a little bit more closely. So what does triage mean? Let's see. Triage. I think I remember that one. It's French for go to the lobby. No, I'm sorry. No. In all seriousness, I'm joking. The Oxford Dictionary defines triage as the assignment of degrees of urgency to wounds or illnesses to decide the order of treatment of a large number of patients or casualties. So that makes sense, right? Okay, when the nursing staff at the hospital evaluate a patient to determine where to send them, they are trying to determine the severity of that patient. Believe it or not, the hospital ED does not have limitless beds. They are a commodity and they do run out. Just because you came in on an ambulance does not mean that the level of urgency of your condition exceeds that of others who are already waiting. So unfortunately, you might have to start in the lobby, even if you came in on an EMS truck. Sometimes that's just the way it works. But don't worry, never fear. The hospital staff is ready and waiting to get you a triage evaluation to determine the level of your severity and get you to the right place from the lobby. Just know that if they have others that are more critical than you, you may be waiting a little while. But don't worry. If we as your EMS providers feel that the nursing staff isn't understanding the severity of your condition, we will advocate for you. We'll try to make sure that they have all the information they need to get you the care that you need as soon as possible. But ultimately, we have no control over where you end up at the ED. And listen, honestly, don't give the nurses too much flack either. They have a job to do just like everyone else, and they really are trying to make sure that everyone gets seen in a timely fashion. So, all that to say, the next time you think you're going into a room at the hospital right away, just because you arrived on an EMS truck, remember this. If you need medical attention, no matter what the reason, we, your EMS professionals, we're there for you. And if you need transport to the hospital for further medical care, no matter what the reason, we, your EMS professionals, we're there for you. And so are the hospital personnel. But if you stubbed your toe, you might end up in the lobby for just a little bit. We'll see you next time.